Thank you, Chairman. Director Botticelli, I wanted to follow up on the issue of the medication cap for buprenorphine. And as I understand it, I've certainly written, I know others here have in the Congress, and on this issue, but do you know where the decision-making is in Health and Human Service? Because right now the cap still exists, right? And so as we think about trying to increase our capacity for medical-assisted treatment, how quickly do you expect the administration is going to look at lifting the cap so that we can increase our capacity there?
Sure. So I believe that's still open for public comment now until, I believe, the end of May. I can check with, in terms of HHS's timeline on that. I would suspect, Senator, that we're going to have a significant number of comments that we're going to have to work through around that. But it is an important priority. But we also want to look at other opportunities through SAMHSA's grants and through increasing the number of physicians who can prescribe this. But increasing capacity is particularly important.
Right. And also, I would also ask you, Director and Ms. Enomoto, about the issue of the bed cap. So we have, as I understand it, there's a cap in terms of residential beds, not only for treatment of substance use disorders, but also mental illness, of 16. And that's an issue also, I think, that as we think about, I know efforts in my own state and elsewhere to try to increase capacity, sometimes it makes sense to increase existing capacity of a facility that already has a good treatment program in place. So what are your thoughts on that cap, and what efforts should be taken to lift that cap as well?
So within the department, CMS has the lead for the Institute for Mental Disease exclusion, IMD exclusion, and they have been working really closely, I think, with states to promote innovation in this area. And California is an example of the state with an 1115 waiver that's looking at providing support to residential treatment providers that have more than 16 beds under their waiver. And so I think there is a considerable effort looking at this, both on the mental health side and the substance abuse side.
And also a lot of this sometimes co-occurring between these illnesses.
Right. We also think it's important, though, to look at expanding options for community-based treatment, because we know that is important and is an avenue that not everyone needs residential treatment. Not everyone requires hospitalization if adequate community-level or intensive outpatient services and supports are readily available.
And as a follow-up to that, I've been one of the lead sponsors of the Pregnant and Postpartum Act, and part of the component of that act also is to look at non-residential treatment options for pregnant women, and I wanted to get your thoughts on that as well.
You know, in the President's FY17 budget proposal, we have proposed a pilot demonstration innovation program, which would request notwithstanding language for the PPW program, because the statute requires that it is right now exclusively residential treatment. We'd like to have flexibility to use some of the funding for states to look at options for multiple pathways to care. So for some of the women in those programs who have other children at home, who have other job or family responsibilities, to be able to participate in treatment on an outpatient basis as well, and to see whether or not they achieve similar or comparable outcomes.
Great, thank you. And Director Botticelli, a lot of the efforts, as I certainly heard the testimony from Ms. Maurer as well, as we think about the supply side piece of this, you and I have talked about this in the past, it's coming over, the heroin and the fentanyl is coming over the southern border. And we've just actually, in the defense authorization, an amendment that I offered is going to increase some resources there for interdiction of heroin and fentanyl. But one of the concerns we've heard before this committee is that the precursor chemicals to make fentanyl are actually shipped sometimes shipped to Central America from China and then smuggled into Mexico, or sometimes actually shipped to the United States and then smuggled into Mexico and then made into fentanyl. So where do you see our efforts? And certainly, Ms. Maurer, if you have any comments on that in terms of what we're doing in looking at our drug policy, what more can we do to address the fentanyl issue on the interdiction? I heard what you had to say on cocaine, and I know that we've seen an increase, but this is really the main driver of the drug deaths, as I see the huge increase in New Hampshire. Obviously, heroin, prescription drugs, but when you combine the fentanyl, that's really the killer.
Correct, and actually, that's the vast majority of increases that we've seen in overdose deaths in the United States seem to be attributed to either straight fentanyl or heroin-laced fentanyl, not just in New Hampshire, but around the country. And you're right, while we know some about the fentanyl supply chain, we need to actually amp up our intelligence around the fentanyl. So we've been working with the intelligence community to look at, so clearly, I think what you've articulated of these being manufactured in China, either shipped directly to the United States, or through Mexico and getting into the supply chain are particularly important areas, but we need to continue to study that. But we have had, China has actually moved to schedule a number of new chemicals, including acetylfentanyl, which is one of the precursors of that, and we continue to work with the Mexican government. I was just down there in March, meeting with the Attorney General, focusing on both reducing poppy cultivation and increasing their efforts around fentanyl and fentanyl labs.
Good. I didn't know if you wanted to comment on this at all.
Yeah, we don't have any specific work focused on fentanyl. We've done work more broadly on supply exchange security and drug control policy,
Okay.
but nothing specific to fentanyl yet.
Well, I think we're going to probably have you engaged on that too, just because this is a huge growing issue.
Fantastic.
Thank you. One final question I have, we've been seeing these reports about the increased price in naloxone, and we all know, I'm having obviously been working on this issue with you and having been in my state doing ride-alongs with our police and fire, without Narcan, we're saving so many lives. Our drug deaths numbers would be so much larger without the access to the life-saving drug. And in the CARA bill, that's a key component to it. But yet the reports are that I've been seeing, at least in the news, is that an increase in this drug price. And do you know what's happening with this? Anyone who would like to jump in and comment on this? The increases in naloxone prices, why these price increases are occurring, and should we have any concern that some manufacturers are looking to profit on this epidemic? I just think it's important that we highlight this and understand it.
I wish I could give you the reasons why the manufacturer has decided to increase the price of this. My gut tells me the same thing that yours does, is that there's some opportunistic issues.
I don't like what my gut is telling me.
Yeah,
That's why I'm raising it.
No, I think you're absolutely right. I think what we've been trying to do in acknowledging the price increase around naloxone is to look at, through CARA and other vehicles, how we can get increased access. There has been a purchasing collaborative set up through National Governors Association, U.S. Conference of Mayors, to harness their purchasing authority to do it, as well as SAMHSA is giving guidance to states through their block grant about using naloxone purchase. But it's particularly disturbing that the cost has gone up dramatically at the time that we need it the most.
I just have, I think as we think about this issue, we're in this very public hearing. I hope that those who are hiking up these prices take notice that we notice, and we're going to be focusing on this, because the last thing that we want as we increase access is the price to increase so that we can actually serve fewer people.